Hey y'all, welcome to the live. Welcome to the live. We're gonna go ahead and get started on this Friday night. How was the fireworks? Did y'all go to the fireworks? Enjoy the fireworks? Anybody enjoy the fireworks yesterday? I did not see the fireworks yesterday. I just literally, what did I do? I relaxed. I did not see the fireworks yesterday. Hey, welcome. Welcome to the live. How are y'all doing this Friday night? We're going to go ahead and get started in a minute because you already know I do not like to hold up my live because a lot of people come and watch it on the replay. So I don't want to hold it up with the chit chat. But I was just asking for the people that just came in, please go ahead and hit the like button for me. And thank y'all for tuning back in this Friday night. All right, y'all. Y'all see the title. Y'all see the thumbnail. It is Friday night, and we are going to get into the video. Let's go ahead and get started. Thank y'all for hitting that thumbs up button. Please hit the thumbs up when you come in. Let me know if y'all can hear me too. That's another thing. I need to make sure. Let me get set up and situated. Make sure y'all can hear me. Let me know in the comments, please, if you can hear me. I just put it in the chat. I don't want to start because last time I did a whole live and nobody could hear me. So please let me know if you can hear me so we can go ahead and get started. Welcome, welcome, welcome. And when you come in, go ahead and hit that thumbs up button. But if y'all can let me know if you can hear me, we're going to get started. Let me see. I just want to check y'all. Give me one moment really quick because I do not want to do this whole live and then nobody can hear me. Okay, thank you. Thank you, Maria. Thank you. And welcome to the live. I appreciate y'all tuning in. Okay, so she said she can hear me, so let's go ahead and get started. So, y'all see the title? Y'all see the thumbnail? Let's get into the top 5 paying jobs for 2024. So, with so much uncertainty in the world, it is hard to try to figure out which career options are the most profitable long term. I think that's a lot of people's issues. And when many join the military, they don't spend a lot of time doing the research on what jobs are, what options would be best for them 10 to 20 years down the line. A lot of people just watch a lot of YouTube videos or just hear from a friend of a friend of a friend, oh, this is a good job or you should do this, but they don't put in the work on picking the job for them or picking a job that is going to still be around 10 to 20 years from now. So sure, you can pick a job that interests you if you love animals or if you love police officers and you want to be an MP, but will it be something that's sustainable and susceptible? Y'all know what I'm trying to say. Sustainable down the line. And a lot of people pick based on bonuses. So when you go into recruiting office, when you go into MEPS, they will offer you a giant bonus for some jobs. Usually these are the jobs that nobody wants or the jobs that don't have a long living rate, like driving trucks in Iraq. Like nobody, and I don't want to say nobody wants to drive trucks. The life expectancy on back in the day, especially when they had mortars and rounds, driving trucks in Iraq was not very long because you get blown up. So in order to get people into those jobs, because nobody wanted to do it, they will offer you a $40,000 bonus, a $20,000 bonus. And people were jumping on those jobs based on the bonuses, but not really knowing what the job entailed and what the life expectancy was. So don't pick it on the bonus, but you want to pick something that is going to transition to a high paying job, or not necessarily a high paying job, but it's just going to transition into a civilian job in the event that you decide you don't want to stay in the military and the military is not for you. In the event that you do 20 years and you really love it, you want it to be something that's going to be around 20 years from now. So profession, and something that's going to increase over time. So don't get me wrong. Like I always say, I was one of those people that I did not do the research in my job. I went into MEPS willy-nilly with no research, and I was like, oh, this sounds like something that I can do. But I will say that I was blessed in picking a job because I picked something in the medical field. Now, I didn't know at the time that the medical field would be something that would be long term, but deep down somewhere, I knew that modern medicine wasn't really going anywhere. And so we all learned during the pandemic in 2020 that healthcare was something that was essential. And even so much that we needed healthcare workers, we needed nurses to actually physically go into the hospitals to help patients. It wasn't one of those jobs where a lot of people work from home, a lot of people did teleworking, they laid a lot of people off. No, the healthcare was something that was booming. They needed you in the flesh to be in there in the hospital taking care of patients. So as we know, the healthcare field is not one that's going away anytime soon, especially an in-person job. So in this video, we are going to discuss the top 5 paying jobs for 2024, the top 5 paying jobs that are going to yield long-term sustainability. So I am going to break this video down into 2 parts as always. Number 1 is going to be the top 5 paying jobs. We're going to go through and look at some of those top 5 paying jobs. And then number 2 is the quality of life in those jobs. Because yes, it could be a high paying job, or yes, it could be a job with a huge bonus. But is it something you really want to do every day? Is it one of those jobs where you walk into work and you hate your job every single day? So you gotta weigh the pros and cons in all of it. And I always tell y'all, weigh your pros and cons, because yeah, if it's something you want to do 10 to 20 years from now, you want to make sure it's something that you can that's going to be sustainable for you. So before we even get into the video, before we even get into the top 5, I need y'all to do me 2 favors. 2 favors that are free $99. I need y'all to go ahead and smash the like button, because that like button really, really does help out my channel. It really, really does bring people in, because when they see that people are liking the video, or people are getting some out of the video, or people are engaging in the video, YouTube pushes it out to more people so that they can see the video. And we are trying to grow this little channel for 2024. So please go ahead, y'all, hit the like button, the people that are in here. And then the other thing that I need y'all to do is let me know, take a wild guess which jobs you think might be in the top 5 for 2024. You don't have to list all 5 jobs, but like on the top of your head, if you could say, I know this job is going to be around 5 to 10 years from now, and if I was joining the military in 2024, I would pick this job. And I'm not going to choose jobs like doctor or psychiatrist or veterinarian, because those are not jobs that enlisted personnel pick. My channel is catered more towards enlisted, but it will be jobs that fall in those categories. So just because I don't say pharmacist doesn't mean pharmacy in general is not in that category, or being a pharmacy technician is not in that category. And generally in the military, when it comes to enlisted, the enlisted personnel are technicians. So we got KKT Matthew, thank you for joining. He put BUDS instructor. What is that? Can you break it down for us? Because I've heard it before, but for the people that may not know, can you break it down and let us know what that means? Maria, if you're still there, can you put a job in the chat that you think is going to be long-term, or something that you're going to be, that if you were to join, it would be something you would pick for 2024. So y'all go ahead and put it in the chat. And if you're watching this on the replay, because I know I get a lot of people that come through and watch it on the replay, go ahead and put it in the chat. Let me know what jobs y'all think are going to be around. Like, what healthcare jobs for enlisted personnel do you think are going to be around 5 to 10 to 20 years from now and are still going to be booming? And so I was thinking about when I wanted to present this video, should I go from top 5 with 1 through 5, 1 being the top job, or should I count down from 5 to 1? What do y'all think? I think I kind of know how I'm going to put it in the video. So Maria said RN. RN, well, you know what? There are enlisted that are Charlies, which are technically nurse practitioners, but an enlisted personnel can be an RN. Usually that's an officer, but definitely there is a job that I'm going to present on my top 5 list that I would say would fall into that category. And so KKT Matthews said basic underwater demolition SEAL. That's a far out job. And speaking of that, in this job description, I do include, I said Army. Well, did I say Army? Yeah, I did say Army, but but I include other branches, so Navy, Air Force, and I include them because for the medical field in particular, we all train in one place. So if you do any medical job, whether you Navy, Air Force, Marine, you're going to train, and everybody's going to get the same training in San Antonio, Texas. San Antonio, Texas is the medical center of excellence. So that's basically like the college for military medical jobs. So everybody does it there. So you may see some jobs in here that are not specifically Army. I think it's only one on the list because I couldn't find a video for Army personnel. All right, let's go get in. Let's get into it. He said air, sea, air, land, SEAL. That's a good one, but I'm sticking to category. I'm sticking to the category of medical jobs. So let's go ahead and get into it. And I think I'm going to start with number 5 and work my way down. And Maria, this one is for you, girl. This one is for you. So number 5, and I have a video to go with it, is going to be combat medic. Now, this is something that they offered me when I was at MEPS, when I was picking my job for the Army. They offered me combat medic, and I said, no way, no way. Now, it wasn't combat medic, it was airborne medic, which is kind of a combat medic, but you just drop out of the airplane and then you land and then you give people medical aid. And I was like, no, I am not dropping out of airplanes. If you can drop out of an airplane, let me know in the chat. Yes or no, if you think you could do that. And then also number 5. So when I count down and I do 5 through 1, let me know in the chat at the end which job you would do, or which job, like if you thought that job would be on there. Let me know in the chat, and you can just put like number 5 combat medic or number 1 blah blah blah. So let's get into combat medic so I can show you all exactly what a combat medic does. Let's see.
Medic is one of the toughest jobs in the military, and here's why. A combat medic plays a unique role in the Army. In addition to being experts in battlefield medicine, they must also possess tactical and combat skills to be used on a moment's notice. In order to help wounded soldiers on the battlefield, combat medics must be able to perform emergency medical treatment while under attack, as well as fight back alongside their fellow soldiers. This double duty makes them incredibly valuable, but also susceptible to PTSD, burnout, compassion fatigue, and a host of other potential issues. In addition to Army basic training, combat medics must also undergo Advanced Individualized Training, or AIT. This can last anywhere from 16 to 68 weeks, depending on the area of specialization. During this time, trainees learn many of the skills they need to operate on a battlefield, like basic first aid, CPR, trauma medicine, and wound care. Following AIT, combat medics are placed where they are needed most.
All right, y'all. So combat medic was one of them. And I think Maria, that's the only one in the top 5 that I have that I would say would fall under your job. Like I said, RN is typically an officer. Enlisted can't join as RN. Enlisted is just like the lower ranking. But there are a lot of combat medics. I know I got a bunch of combat medic friends. And in the hospital setting, because that's in a deployed setting, all the stuff you would do in a hospital setting, the combat medic would be like the MSA. So basically they screen you, they do your vital signs, they triage you, they do all of the stuff. And then you would go to the RN or the, not the LPN, but the PA the physician assistant, and then, you know, they would see you and treat you. But yeah, so RN is number 5. I got one more video for combat medic. Y'all let me know if y'all want to see it or y'all want to go on to number 4. Let me know in the chat, and I'll wait. I got one more video for combat medic. Thank y'all for joining the live. For the people that are just coming in, please go ahead and hit that like button. You see, when y'all hit that like button, it brought more people in, and that's what we're trying to do. Do y'all want to see the other video, or y'all want me to go on? Because if not, I think I might go on to number 4. She said, yes, she would like to see it. Okay, let me put it on.
Me what like your daily duties.
Currently, I work in a hospital. I work in outpatient
Okay, so
behavioral
this
health.
was
So
the
when you work in a
hospital
hospital, you're either going to be inpatient or outpatient. The main difference is like the work schedule. So inpatient, you work 12-hour shifts. Outpatients, typical 7:30 until around 1700. So I work at an embedded behavioral health. Let's say at Fort Hood, each brigade is aligned to an embedded.
Oh, my bad. Sorry. So this is behavioral health. My bad. I thought it was the medic one. So that kind of gave it away for number 4. I'm sorry, Maria. I thought I had 2. But let's go on to number 4.
Behavioral health clinic.
Okay.
And so that's where the soldiers from that brigade go to. So they have chaplains in it, MFLEX, social workers, psychologists, psychiatrists, and behavioral health techs.
All right, my bad. So that video gave it away, but number 4 is behavioral health. And I'm surprised nobody picked this or put this in the chat, because I feel like everything lately is so, you know, feelings and behavioral health and mental health and all of that stuff. And so there is definitely, as you can see, a need for behavioral health techs. And one of my very, 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 very best friends in the Army, like knew her for like over 15 years now, best friend, is a behavioral health tech. And like he said, so there's an inpatient setting, there's an outpatient setting, and so inpatient, of course, is if you get admitted to the psych ward, you can do that as a enlisted. Or the outpatient setting is if you just come for like group, or you come see the psychologist and you go home and do your regular stuff. So there's 2 different sides to behavioral health. It's a really, really rewarding job. It's something that not a lot of people pick, or not a lot of people choose. And that's why I wanted to bring these top 5 to y'all, because people don't necessarily know that it's an option. And like for me, when I joined, I did not know that there were all these jobs. Like I said, I didn't do my research. This is why you all have to do your research when joining the military. So behavior health was number 4. Now it's got me scared, so I could see what's number 3. So I only had 1 for behavior health. Number 3, moving on to number 3. This is one that, like, even still, I'm still flabbergasted that this is a job. Like, it took me like a good 6 years in the military, and I'm like, that's the actual job? Like, that's what you do all day? Like, that is you joined the military for that job? That's not just like a side job that they got you doing. Y'all will never, ever, ever, ever guess what this job is. It's low key, it's a chill job. And I think it's a job if you like to move around, if you like to fix stuff and do stuff and move and deal with your hands, it's a good job. So bringing us down to number 3 is the biomed equipment specialist. And so this particular job is one that we need you all us in the healthcare field that's doing patient care need you all, because this person goes in and literally fix all of the equipment, the medical equipment. So they're not out there working on cars. They're not out there. Who just tried to call me? They're not out there working on cars. They're not out there like working on crazy random stuff. They are fixing medical equipment that is essential to the mission. So let me let y'all see what this biomed specialist does.
Using mechanical, hydraulic, pneumatic, electronic, digital, optical, and radiological principles. along with the assembly and installation of new equipment, you may be called upon to calculate the power and space requirements for medical equipment installations. You may also be tasked with preparing and submitting medical equipment status reports and maintenance record keeping.
We only teach the basics here of troubleshooting and repairing medical equipment. Whenever they get out into the field, they're going to be challenged on a daily basis, from dynamic equipment to complex situations of how they can better assist those healthcare providers in diagnosing and treating patients.
After successfully completing Army Basic Combat Training, you will attend 44 weeks of advanced individual training at Fort Sam Houston, Texas. There, you will learn how to use diagnostic and calibrating tools to service, maintain, troubleshoot, and repair a variety of sophisticated medical equipment. Following your successful completion of all required training, you will be eligible for assignments at military hospitals located around the world or deployed as a member of a field hospital. As a soldier, you will also have the opportunity to further your military career through leadership training and acquire additional civilian education through specialized training, college courses, and certifications. Your military experience may help you in your transition from the military to the civilian workforce, where you may pursue a career with medical equipment manufacturers, hospitals, clinics, or research institutions.
There's plenty of employment out there and a great job opportunity for them. And not only just as a biomedical equipment technician, but they can further their training and continue to get certifications and college that will help them get into management roles that will make them much more prominent in the career field.
Maintaining the Army's medical equipment through experience and progress, the biomedical equipment specialist ensures high-quality health care through medical equipment readiness.
All right, y'all. Biomed equipment specialist. And did you hear at the end, like all the certifications you can get? Like, just think of all the stuff you can do on the outside. So a lot of people do what's called moonlighting. So basically, you work your regular full-time job during the day. Then you work at a local hospital in the evenings and do your same job, but you're getting paid. So basically, you double tapping. You're getting 2 paychecks. Baby, if I had the time, I might take up a second job. But just think of with this job is such a job, is such one that I would never think of. But it just seemed like you just get to be all over the place. You get to see a lot of stuff. You can do so much with it. And at the end, I'm going to tell y'all how much each one of these jobs make starting out. Biomed, baby, is number 3 on the list. It's getting close to number 1. So they making some money. And so this is somebody, next video is, he's going to actually give you his firsthand experience as a biomed tech. So let's watch.
Welcome back to my channel, Dominga Shaitan. Most of you guys know I am currently deployed right now in Kuwait as a mental health technician. I thought it'd be really interesting to show you guys people from other career fields, ask them questions about their jobs and their Air Force experiences.
Okay. I'm Staff Sergeant Leyland Umblas. I'm a bioenvironmental engineering technician. My official duty title is NCOIC Readiness Planning and Operations. I have been in 9 years as of the 29th of this past December. I'm currently stationed at Colorado Springs. My first duty assignment was Tinker Air Force Base in Oklahoma City. I'm currently deployed with my girl Minga right there. Moving on from this assignment, I am currently en route to PCS to Incirlik, Turkey. Honestly speaking, this job has allowed me to do some of the coolest stuff I've ever done. The schedule is extremely flexible. You can pretty much do essentially whatever you want as long as you get your work done, if you get your work done. The only downside is it's one of those jobs where you genuinely have to be in it to be good at it, and once you get good at it, you can coast through it like any other job. The only downside is you're kind of doing a lot.
All right, y'all. So y'all heard it. He said that the hours are flexible, which I think that's a good thing. But he did say you're doing a lot. And I would think it's not like you just training on one specific equipment. You kind of like have to learn a lot of different things. But hey, I think it's beneficial, very, very beneficial. Okay. Moving on, moving right along. We coming down to number two. Number two. And so in this video, it's kind of, I don't want to say a long video, but she goes very into detail about what she does. So anybody want to take a stab at what they think number two is? It's dealing with not people. I'll give you that one. It's dealing with healthcare, but not people. Take a guess in the chat, and I'm going to pull it up.
It really depends on where you get stationed, because there are units that have horses, so you'll work with the MWDs, privately owned animals, so dogs and cats, and the horses that's at that duty.
Real quick, Valerie. Hey, Valerie. Thank you for watching. Thank you for commenting. Administration is one. That's really good. And you know what? When I said healthcare, but not people, that was a good guess. But no, as you can probably tell, it's vet tech, veterinarian. But let's get back. But that was a really good guess. And there is healthcare administration, which it didn't make this list, but we're going to talk about that in another video.
Station. If you're like me, where there are no horses, and I'm not at a tow unit, I'm just at a regular clinic, you're going to work with the privately owned dogs, cats, MWD dogs, and us specifically work with Border Patrol also, because we're near the Canadian border, so we work with the Border Patrol. If you're at a tow unit, you're only going to be working with the MWDs. You're really going to be doing Army stuff. You're going to barely have time to do vet tech stuff, really. But yeah, no exotic animals at all. It's mainly dogs, cats, and horses.
All right. So she kind of just broke down what she does. And like she said, depending on where you are, it kind of tailors the animals that you see, especially being near the border. I didn't even think about up there. She may be probably at Fort Drum, New York, which is very close to the border. But I would imagine, like, if you're in Texas or somewhere down south, you see more like maybe wild coyotes or that type of stuff down there in that area. And then I know for me as a pharmacy technician, and if y'all want to see a whole video on pharmacy, I can definitely break that down. I had a few people in the comments a few lives ago ask about pharmacy technician. But for us, we actually administer medication to the animals. Like, they have an actual ID card, like a military ID card. And some of them have to get insulin, and some of them may have to get other, antibiotics and other medications. So we don't see the animals, but the handler comes with their ID card, and we actually dispense medication to them sometimes, depending on where we at. I have done that before. But yeah, we definitely need the vet techs. I'm not a big animal person, but I know, people are very serious about their dogs usually. So there is always a veterinary clinic on pretty much every base, because people have animals. So, and we need vet techs to do that. And especially what the other thing that she was talking about was the military dogs. So they handle the military working dogs. And if a working dog is sick or whatever the case may be, gets injured, gets hurt, they have to help the actual military working dogs, and the dogs you may see those dogs like at the airports and stuff like that. So it's actually a big job. All right, y'all, we finally got down to number one. And unfortunately, I cannot play the video, the music, because she has copyright music and YouTube is not gonna get me. But I will play the video. It's just going to be with no music, with no sound. So number one is a dental specialist or dental hygienist. As you can see, she's talking about what she does. She changed into scrub. She get all the utensils ready. She's getting the stuff ready for her oral surgery, prepping the room for the dentist. She hands the utensils. She's actually making molds of dentures and other retainers, it says here, and doing all of the things. And so this is actually the number one job that they offer me when I joined the military. And I was like, no way, Jose, I do not want to be digging in people's nasty mouth. But I like this because she's showing like all of the things that she has to do. Maybe they had to get training on babies and stuff like that. But too bad I couldn't actually play the video. But yeah, so dental technician is the #1 job. And y'all, wait, bringing it back to dental technician, I can see why. Do y'all know, like, people in their veneers? That's like a big thing right now. People getting veneers and veneer techs. Veneer tech is not a real job. There's no such thing as a veneer tech. But a dental tech, maybe they help assist in making veneers. Dental is one of those jobs where it's a hands-on job, y'all. You got to think about it. You can't telework as a dentist. Like, you got to actually have your hands in somebody's mouth. People are, the health care is growing because people aren't taking care of their health care in all assets. So that's why the healthcare field is growing. And that breaks it down even to dental care. People don't take care of their teeth. They don't brush their teeth well. They eat all kind of junk and crap. And so we need dentists. And we need dental technicians, and we need people to physically be there when our teeth hurt so that they can fix our cavities, if a teeth break, if we need dental surgery, all of the things. Valerie said, I was offered that MOS and turned it down. Why did you turn it down, Valerie? Was it because of the same reasons I turned mine down? Because you didn't want to be digging in people's mouth? Because people don't take care of their teeth. Like, we circle all the way back around to that. And I just imagine, like, looking into some old man's mouth from, like, the countryside that didn't get good dental hygiene and dental care growing up. Like, because I see these patients. I deal with a lot of retirees on an everyday basis coming to get their medication. And I could not be digging into somebody's mouth. But let me read y'all the stats on how much they make. All right. So we're going to go back to number 5. I think number 5. Hold on. I got it here on my tablet. I got it written here. Number 5 was combat medic. So starting out, and I don't know if this is, this is probably what you get paid on the civilian side, because military pay is not broken down by job. And we talked about that last live. So if you missed last live, there was a girl that literally broke down her paycheck. So military pay does not go by your job. It goes by your rank. So these prices, or these pay scales, I would imagine would be on the civilian side. So combat medic starts out at $41,000 a year, which is not a whole lot, but it's not bad either. Number 4 is behavior health tech. Hold on. Am I doing this right? Hold on. Number 1. Okay, I'm sorry, y'all. Number 1 in pay is vet tech. Number 5 in pay. Sorry. Number 5 in pay is vet tech. A vet tech makes $39,000. So vet tech makes $39,000. Combat medic makes $41,000. Dental specialist makes $50,000. Biomed specialist makes $50,600. So they just make a little bit more. But I feel like with biomed, you can do a whole lot. Like, you can pick your hours as a biomed tech. And then last but not least, the one that makes the most, which I can see why, is behavior health tech. They make $56,000 starting out. And that's because people need their behavior health techs, especially in a time when mental health matters, which it does. I think we need more and more mental health and behavioral health techs. So that pretty much breaks down the top 5 jobs for 2024, which you should be looking at or looking into if you are thinking of going into the military and going into the healthcare field. These top 5 is definitely something that you should look into for the long run. And Valerie, I don't know if me and you missed our calling with the dental, but I'm happy to not be digging in people's mouth. Let me know. Would you mind letting me know if you in or if you were in? What job did you do? Did you do a medical job? And if anybody has any questions in the chat, please let me know what questions you may have. They could be anything related. Don't even necessarily have to be military related, but let me know. I'm going to keep the live going for a few minutes longer to answer people's questions. And I always get questions after I end the live. So if y'all have any questions, definitely go ahead and let me know in the chat if any of this resonated with you, if any of it was entertaining to you or knowledgeable to you. Please go ahead and hit the like button. If you didn't like the video, go ahead and hit the like button, the thumbs up button, or the thumbs down button, and let me know, because it really does help my channel. And I'm trying to see what my next video is going to be. I think my next video might be either job related or relationship related, because I seem to get a lot of those type of questions. So y'all let me know what you think. Oh, Valerie says she leaves for basic training in 2 weeks. She chose 92 Fox. What's a 92 Fox? I've heard of it before. Let me Google it. But let us know in the chat, Valerie, what's a 92 Fox? That's where I heard it. Somebody else said they picked that job. Petroleum supply. Somebody else, like in a live a few years ago, was like 92 Fox. And I was like, what is that job? Petroleum specialist. Okay. I hate gas. Like, I hate pumping gas. And I just, when I read petroleum specialist, the smell of gas comes in my nose. I don't even pump my own gas just because I hate it. So more power to you, girl. Dealing with that gas, I couldn't. Maria says, how do you balance juggling life of being a mom, wife, and your career and being in the military? Girl, this is the $1 million question. Everybody always asks me this question. And I feel like I'm not, I guess I am balancing it. But baby, it's a struggle for me. Like, it doesn't come easy. It is a struggle that I deal with a lot, because you have to pick your priorities. You have to make sure, of course, your family, in my case, is my number one priority. I'm not going to say it should be for everybody, because I can't speak for everybody, but for me, it's my number one priority. But you have where you want to balance being the best wife and mom you can be, but also being the best soldier you can be. Like, you don't want to be like, well, I can't do that, or I don't feel like doing that, or I'm not able to do that, or I don't want to do that because of this over here. So balance is hard. Like, I'm not even gonna lie, it's hard. And I just think that I chug away at little bits every day is the only way that I can put it. And I try to organize, or what's the word? Compartmentalize, maybe that's a good word for it. The things that I have to do, prioritize. I guess that's the good word. Prioritize the things that I have to do. So there are some no-fail missions at work. There are some things that I have to do at work. And of course, there are things that I have to do at home. And I just prioritize, and I try to communicate that with my husband. And be like, hey, babe, I got this going on. I gotta do this. Can you take care of the kids, or can you do this? And when I get home, I'm like, hey, thank you for doing X, Y, and Z. I got it. You know, that's the only way I can do it. But planning is the other thing. I'm one person that, like, I do very well with planning out your day, even your week. For me, like, I literally use my planner, and I have my planner, and I literally plan out my week. And so things don't tend to pop up. And so when things don't pop up, you can prioritize better. So I think if you take anything from my rambling, it would be to plan your week, literally plan everything out, use a calendar so that you can prioritize what you have to do and what you need to do. And communication. Communicate with your leadership, communicate with your spouse, communicate with your kids if they are old enough. Like, I have a 9-year-old. Of course, I don't tell her all the ins and outs of everything, but I can tell her, like, hey, I have to do this. Like, or mommy really has a big meeting and I really need to be there on time, or, you know, things like that, so that everybody's in the know and everybody can help you. So that's how I balance. And then just with career, planning the long term. I sit down with my soldiers when I do their counseling at the beginning, their initial counseling, and throughout, maybe quarterly throughout the year, I tell everybody, give me 3 short-term goals, give me 3 long-term goals of the things you want to do. And this is for, who is it? Valerie too, that says she's about to go in 2 weeks to basic training. sit down with your leadership, sit down with your NCO, sit down with your supervisor. You create a plan of what you want to do, of what you want to achieve in the military. 3 short term is things within, I would say a year to 2 years, and then long term, 3 to 5 years out. Then you can you can create a plan or a career map on how you're going to get to those goals. Hey, in a year, I want to go to the promotion board, or I want to go to the Soldier of the Month board. So now I know what I need to do between now and a year to get to that promotion board. In 5 years, I want to achieve X, Y, and Z. I want to get a highest score I can on my PT test, or I want to get all of these certifications. Now I can plan, okay, in 6 to 9 months, I'm gonna plan for the board, and I'm gonna study for the board, and I'm gonna do the board so I can hit that at my 1 year mark. And now when I get to my 1 year mark, I'm done with the board. Now I can focus on college. Okay, I did my college from 1 to 3 years. Now that I'm done with college, I want to focus on being getting all these certifications. But if you don't plan it out and you just go willy-nilly, then you get 5 years down the line and you look back and you're like, well, dang, what did I achieve? Or I had all the time in the world to achieve all these things, and now I got kids, or now I have a family, or now I'm stationed overseas and I can't do those things. So plan out your career, basically, literally plan out your career. And then you need to constantly be checking in with your own goals. So at 6 month mark, at that half a year mark, hey, am I doing the things that I need to achieve getting promoted in another 6 months? Because I said I wanted to hit that within my 1 year. You can always check in. But if you literally don't plan anything and you don't check in and you don't see where you are in your goals, you gonna waste a lot of time. And I tell people the Army is going to get their time out of you. They're going to get what they want out of you as far as the work that they need done. You need to make sure you are setting yourself up for success and getting the things that you want out of the military. What did y'all sign up for? Did you sign up for college? Did you sign up to travel? Did you sign up to save money? Did you sign up to get certifications? Did you sign up to get experience? Make sure you achieve the things that you signed up for. Don't just join and be one of 100,000 and don't achieve your goals. So that was a long ramble, but that was a really, really good question, Maria. And a lot of people suffer from not planning or not being able to balance or not knowing how to balance. And it is a detriment to them and their career. And then they have a horrible experience. And then they blame the whole Army because they didn't do the things they needed to do to be successful. Anybody have any other questions for me? We are at 42 minutes, but y'all been very good to me in the live. I appreciate y'all hitting that thumbs up button. It really, really does shoot my channel out to more people so that they can come and tap in and see. And I'm here trying to get back on a routine every Friday. So if you were only able to tune in for a little bit, see me back next Friday. If y'all have any suggestions of ideas that you want to see or topics that you want me to hit on and talk about, leave them in the chat. Even if you come back to it, you can drop it in the chat in the replay. I always check out the comments. I always respond to my comments, and I always try to tune in with y'all. So I really, really appreciate y'all. Thank you. Thank you, Maria. Thank you for chiming in, and good luck for Valerie, who's going to basic training in 2 weeks. I got a whole playlist, girl, on basic training and being a woman in the military. So make sure you check out that playlist. And until next Friday, I will see y'all in the next one. Bye.